When the cutoff lists are published and you realize you missed an MBBS seat, it feels like a heavy door has permanently closed. For years, the singular goal was becoming a doctor, and missing that mark carries an immense cultural and emotional weight. But step back from that closed door and look at the broader picture. The modern healthcare industry is a multi-billion-dollar machine, and the vast majority of its moving parts operate completely independently of physicians. Hospitals, diagnostic centers, and rehabilitation clinics run on the backs of specialized professionals. You are immediately hit with an overwhelming alphabet soup of alternative degrees. There is BDS, or Bachelor of Dental Surgery, BAMS, Bachelor of Ayurvedic Medicine and Surgery, BPT for Physiotherapy, MLT for Medical Laboratory Technology, BASLP for Audiology and Speech-Language Pathology, and Pharm D, a 6-year Doctor of Pharmacy program. The immediate instinct for many students and parents is to grab whichever degree sounds closest to a traditional medical doctor. They choose a backup plan based purely on perceived prestige, ignoring the tuition costs, the years required to graduate, and the actual day-to-day reality of the job they are signing up for. Every single one of these alternative medical degrees forces you to navigate a central trade-off: clinical autonomy versus immediate employability. You have to choose between running your own practice or plugging directly into a massive corporate hospital system. To make an objective decision, you need to stop looking at these 13 degrees as a ranked list of next best options. Instead, you need to filter them into distinct operational tracks based on how they actually function in the economy. The most effective degree for you is the one that aligns strictly with your available financial capital, your timeline to start earning, and the specific daily lifestyle you want to maintain. Let's start with the clinical autonomy track. This path is dominated by dentistry, or BDS, and the Ayush degrees, which include Ayurvedic and homeopathic medicine. This chart compares the steep upfront costs of these programs against a standard low-fee baseline. A private BDS degree will easily run between 10 to 25 lakh rupees, and Ayush degrees often demand 8 to 20 lakhs. You are also committing to 5.5 years of study and internship before you can even enter the job market. The justification for this immense cost and time is the outcome. These degrees grant you an independent clinical identity and the title of doctor. However, building your reputation takes a long, flat ramp-up period of 5 to 7 years before you hit a high-income potential zone. There is a severe bottleneck here. Urban areas are saturated with dental and homeopathic clinics. Securing the degree is only the first step. You then need massive secondary capital to lease a space, buy specialized equipment, and float your personal expenses while you wait for patients to arrive. There are regional buffers to this rule. In Kerala, the booming Ayurvedic wellness and tourism sector creates heavy demand for BAMS graduates. This allows new practitioners to find immediate salaried employment in resorts and wellness centers rather than relying entirely on starting a private clinic from scratch. The clinical autonomy track requires high capital reserves from your family and the patience to survive a brutal multi-year wait before your practice becomes profitable. In direct contrast is the hospital machine track. This includes BSc Nursing, Radiology, Medical Laboratory Technology, and Operation Theater, or OT, technology. The entry requirements here are highly predictable. The day-to-day reality of this work is harsh. You will face physically demanding shift work, constant emergencies, and modest starting salaries in India, often hovering around 20,000 to 40,000 rupees a month. The core trade-off is absolute. By choosing this track, you permanently sacrifice clinical independence. You will not open your own clinic. You will execute your highly specialized skills entirely within the rigid hierarchy of a corporate hospital. This track is the pragmatic choice for budget-conscious students. If you prioritize global mobility, stable income, and graduating with minimal debt over holding a prestigious title, this is where you belong. Sitting directly between the clinic and the hospital is the niche independence track. This covers physiotherapy, optometry, and BASLP, which focuses on treating hearing and speech disorders. These programs demand a moderate entry investment, typically costing 2 to 6 lakh rupees in total fees and requiring 3 to 4.5 years of study. These roles capitalize on massive, undeniable demographic shifts. An aging population requires joint rehabilitation. Increased screen time drives demand for vision care, and a growing awareness of special needs fuels the need for speech therapists. Their distinct operational advantage is flexibility. You can work in a hospital setting, or you can build a semi-independent practice, like an optical shop or a neighborhood rehab clinic, maintaining highly predictable hours far away from critical care emergencies. The catch is that your income relies heavily on location and footfall. Because you are operating outside of a hospital's centralized referral system, you need strong communication and retail skills to network with local schools, pediatricians, and the general public to build your client base. This track suits entrepreneurial students. It offers the direct patient interaction of the clinical route, without the life-or-death stress and extreme capital requirements of emergency hospital medicine. Finally, we have the tech and industry track. This is engineered for students who prefer systems, chemistry, and complex machines over direct, face-to-face patient care. The core degrees here are pharmacy programs like BPharm and Pharm D, alongside Biotechnology, Biomedical Science, and Biomedical Engineering. The financial and time inputs vary widely, but they can be heavy. A rigorous Pharm D program, for instance, demands up to 6 years of study and can cost 15 lakh rupees at top private institutes. The outputs are purely structural. You will find yourself working in laboratory research and development, corporate healthcare compliance, medical device sales, or managing millions of dollars of hospital equipment. The primary bottleneck is early career stagnation. Entry-level Bachelor of Science roles offer low starting pay. To climb the corporate ladder or lead research teams, pursuing a master's degree, a PhD, or an MBA is almost mandatory. This track is ideal for analytical, system-focused thinkers. You are bypassing the clinical environment entirely to play a long-term corporate and industrial game. The perceived prestige of a degree's acronym is totally irrelevant if the daily reality of the job conflicts with your financial situation and your personality. Take a look at this quadrant chart to map exactly where you fit. We are measuring the work environment, from hospital systems at the bottom to independent practice at the top, against your investment, from low-cost, fast employment on the left to high-cost, long-term returns on the right. If you are budget-conscious, need guaranteed employment quickly, and want international mobility, you map to the bottom left. BSc Nursing and Allied Health belong here. If your family has the capital to invest, you demand independent practice, and you can survive a 5-year ramp-up to profitability, you map to the top right. BDS and Ayush degrees sit firmly in this zone. If you want to avoid blood and direct patient care entirely, but you are willing to pursue a postgraduate degree to climb the corporate ladder, you land in the bottom right with pharmacy, biotech, and engineering. And if you want flexible hours and the ability to pivot between a hospital salary and a small private clinic, BPT, Optometry, and BASLP hover right in the center as hybrid options. Do not pick a backup plan out of panic. Use your constraints to your advantage and pick the specific degree that engineers the exact life, income, and lifestyle you actually want to build.